It's been 5 years since COVID-19 became a pandemic, forcing unprecedented closures at our border, separating families for months in some cases, or even years. And through all of it, we relied on our healthcare experts who showed up every day on the front lines, caring for our most vulnerable. And that, of course, includes infectious disease expert Dr. Isaac Bogoch, who joins us virtually now. Dr. Bogoch, thank you so much for being with us today. And as always, thank you for being a constant in those early months and years of the pandemic. It was scary times, but you really helped to educate so many people. I'm wondering, for you, what lessons do you think that we could still learn from those years?
Yeah, there's obviously lots of lessons to be learned, but quite frankly, they mean nothing if we don't actually implement strategies to prevent this from happening again. I think we learned a lot about the need for surge capacity in a healthcare system during the time of crisis. We learned how incredible what we can do from a scientific standpoint when we really pour unlimited human resources and financial resources into something. So, for example, we had vaccines roll out in December of 2020, about a year after this virus was identified, but having the whole world really cooperate and come together and come up with the phase 1, the phase 2, the phase 3 clinical studies that helped develop these vaccines, which truly saved millions and millions of people around the world. So lots of lessons to be learned, but thankfully we're in a much better place right now.
And as we are marking this Sombre anniversary, I do have to ask you, we're dealing with other viruses that could pose a danger right now. Do you think that we're better prepared for the next pandemic than we were maybe 5 years ago?
In some regards, yes, and others, no. I mean, I think it's very helpful that Canada really learned the importance of locally producing things that we need. For example, personal protective equipment and local vaccine manufacturing, which is extremely helpful. These are truly health security issues. And I think we've learned the importance of early detection systems and working closely with international collaborators, because we can do everything right in Canada. But, obviously, if our neighbors don't have the capacity to detect and respond to emerging threats, then we're going to be in trouble as well. I think the other issue, though, is we certainly have seen a greater rise in anti-science rhetoric, and that's only going to hurt us in the long run.
And what is the threat level associated with COVID today? Do people still need to worry about this virus?
Well, that's a great point, because the virus, of course, isn't gone. It's not going to go away. But of course, we can't pretend that it's 2020 or 2021 all over again. We are in the early days, we were admitting younger people to hospital, people who were otherwise healthy in their 20s, 30s, 40s, and many of them weren't dying, but they were getting very, very sick. Nowadays, it would be extremely unusual to see young individuals in the hospital with this infection, and even older, more vulnerable individuals. While sometimes they do get hospitalized for this, they tend to recover, and that's extremely helpful and obviously very different from what we saw earlier on in the pandemic before vaccines and therapeutics rolled out. So it's still around. It's still, of course, a threat to the most medically vulnerable individuals, such as people on the older end of the spectrum or people with underlying health conditions that put them at greater risk for severe infection. And but it's not even remotely close to what it was back in the dark days of 2020 and 2021.
That's good to hear. I just want to go back to something that you just mentioned, that you've been seeing kind of the increase of, anti-science rhetoric. How do we address this, and how do we bring back, the unity amongst all of us to really address these greater challenges?
I think there's a few ways. It's obviously an uphill challenge, but a challenge worth taking. So, there's people who have legitimate questions and concerns about medicine, science, public health, and I think we have to take that seriously. Shaming and blaming is not an effective strategy, and we have to listen to what people's concerns are and address them. We also have to address that there is true disinformation being amplified in online settings, and people are sadly making poor decisions for themselves because of this disinformation. So we have to counter that with credible, high-quality information from high caliber sources so that people can really have a better understanding of the world around them, including health and public health issues that arise. And I think it's obviously a challenge, but it's extremely important to address those issues because ultimately, at the end of the day, we want a healthy Canada and we want a healthy world.
Education is key. All right, Dr. Isaac Bogoch, as always, we thank you very much for your time.
My pleasure.